So in seeking out our panelists for this discussion, we wanted to highlight the work that is currently being done by our faculty, by our alumni, by our students. Palmer Seminary's motto is the whole gospel for the whole world through whole persons. And it is my absolutely unbiased opinion that Palmer Seminary and Eastern University do that work better than almost anyone else. I say that as an alum. So it is my honor to welcome our panelists today. I'd like to welcome up Dr. Jennifer Stewart, who is a former associate professor at Johns Hopkins University and a current Master of Divinity student at Palmer Seminary. Reverend Casey Bien-Aime is the Endowed Chair of Pastoral Care at Lankenau Medical Center and a 2012 graduate of Palmer Seminary. And Professor Sally Stern is a lecturer in nursing at Eastern University. So after one session so far of this symposium, the number one thing that I have heard from people, aside from your guests have been incredible, which I know, is that we want to hear more from them. So to begin, nice, wonderful, broad question. We'll start with you, Dr. Stewart. How have you seen God at work in your time in the medical field?
A great question. I feel like my work has really integrated a couple of different domains of inquiry, one being the medical sciences and the health sciences, but also some social science has come into play, some ethics, some psychology as well. And in my experiences, I've always been astonished by how much science can echo the truth of God. And I'll give you a quick example. In some of the research that I've done around prayer and spirituality, I've seen tremendous change occur in people's lives, which really echoes the scriptures that the prayers of the righteous are effective. And so I have also experienced God in my work in just unveiling some of the mysteries and some of the complexities of how God has created us. One of my passions has always been change, behavior change on an individual level, on a congregation or a corporate level, or organizational level, as well as in the community. And I've seen how complex God has woven us together, each of us having different experiences and different ways of approaching our lives. And I've also been able to have the opportunity to see how science and faith are somewhat related and intertwined in that there's still a degree of mystery. And as a scientist, you can spend your entire life focused in on a particular line of inquiry and still at the end of that journey not know all of the answers, not have all of the answers. And I see that as a parallel between that and the Christian journey, where at the end of our lives, we probably still will not know and have all of the answers. So I've seen God work in science in those three ways.
So I am, as a chaplain, I am in awe of the advancements that have been made. I've worked at a couple different health institutions over the past 10 years, and I see God at work every day as I see advancements made in our interventions, in our medicines, and our technologies. But one way that I've been very much inspired is to see a movement to more holistic care from our medical professionals. I think maybe 50, 60 years ago, medicine was very paternalistic, very much a quick visit and sort of top down from the authority to the person receiving the care. And while it is a slow movement at times, I am seeing more medical professionals sit down and hear the whole story, allowing for people to heal in multiple ways. Because healing is not always in the physical. There is so much more to be done, and seeing chaplaincy, spiritual care, holistic care embraced by so many in the medical field and in the sciences, I see God moving in that and allowing people to give voice to what is most important in their lives and find that healing beyond the curative.
Thank you. So my name is Sally Stern, and I have worked as a nurse for 25 years prior to becoming a nurse educator and then as an educator here at Eastern. And so I have that kind of the direct experience of working with patients. And I had the most unbelievable experience that I was able to work as a labor and delivery nurse and see birth, new life every day. How amazing is that? So, and I have to give a huge shout out to Casey. I haven't even spoken to you, but she has been such an incredible support to the staff and patients. And I'm getting teary-eyed because of the tragic situations that we see her are really unbelievable. So anyhow, I've had many, many experiences of God working as I've taken care of patients, spent time with them, gotten to know them. The other thing that's really wonderful about labor and delivery is it's very much a one-on-one. So you as a nurse, like you know your patients, you know them pretty well. You see them at the King of Prussia Mall 10 years later on the escalator and they're like, Sally, you were my labor nurse. And so they know you, and your direct care, nursing is an art and a science together. And so the art of compassion and care blended with the science of using evidence-based practice in your care of them is really amazing. So that is the first part of my nursing career. The second part of my nursing career is teaching students. And how exciting is that, to teach students and to talk to them about patient-centered care, talk to them about seeing the patient as a holistic person, to talk to them about, I have the advantage of being the advisor for Nurses Christian Fellowship, and we have speakers come and talk about how they've integrated faith into their practice. And then having a student come up to you afterwards and say, guess what? I just prayed with a patient. And they did that because they heard about it and it was modeled for them. And that to me is another huge way that God is working in the arena where I am.
Thank you. So at this time, we invite anybody who would like to ask the first question to come up to the microphone here, or to submit it into the chat or into the Q&A function. All right. Somebody always has to break the ice. Oh, it's a race.
Thank you for your responses thus far. Are there ways in which you've experienced a conflict between your religious beliefs and things you've needed to do in your work?
Yes. The answer to that question is yes. So, and just reflecting on what you said, I also have a nursing background and was also an OB, so I see why we are all on this panel together. And some of the conflicts that I've had have not only been practice related, but also on the research end of things as well. And so for practice related conflicts that I've had with faith and science, sometimes there can be a general perspective on the practice side that we are just now getting to the point where we can start to integrate spirituality, integrate faith, and we're starting to see that it makes a difference, that it makes a critical difference in the lives of individuals. And one of the conflicts that I've had in the academy, in the research domain, has been that there have been many people who have been enlightened, so to speak, of the role of faith and the role of religion in individuals' lives. And I mostly worked with African American churches and tried to bridge that gap between research, the academy, and congregations. But there was always a little bit of pushback in the academy. You know, why does faith make a difference? Why does it matter? How does it have any sort of impact on the science? Because, you know, as scientists, you need to have evidence, you need to have proof, and there's not a full proof of the existence of God and the existence of the impact of faith on individuals' lives. It's a little bit intangible. And as scientists, we like to see the numbers, we like to see the concrete data, and that's not always present. You know, there's something about faith that is just, you're not able to completely touch it, feel it, you know, sense it, you know, with your senses. So there have been multiple conflicts that I've had. I've had to get on my soapbox and say that, yes, faith does matter, and it is critical, and it is a part of holistic care, as you mentioned before. So those are some of the conflicts that I've had in practice and as well as in research.
I think this is my opportunity to shout out systematic theology and seminary education. I could not do what I've done for the past 10 years without that foundation. There's something about reading the case studies, and those are powerful, and, you know, look up all the books about pastoral care. But being in those rooms, especially in the last 18 months, holding the iPad for somebody saying goodbye to their loved one, being the last person to say goodbye to a patient who is passing away, watching people wrestle with hoping for a miracle while seeing their loved one fade away and trying to honor their dignity while hope that they make it back to their previous baseline. Those things still break my heart. They are still the topic of conversation with my therapist. These are still the spaces where I am crying on my drive home. But because of that foundation of education and seminary and having colleagues that know what it's like, has helped me to do this work without burning out, to do this work and continue to give my whole self. My role as chaplain is in accompaniment. I do some pulpit supply, I do some preaching, and that's a different role for me. But my role when I am with a patient is to be that quiet listener. And there are times where what they are saying and what they are hoping for, they don't match what I imagine I would do for my loved one. And it is hard to bear witness to. But because I have that foundation and I have those layers of support from my time here at Palmer and from the many relationships that I've built from there, I feel like I'm able to weather those storms and continue to be present. And hopefully I'll retire from Lankenau many years from now because I have that strength to hold on to during some of the most difficult things that I bear witness to.
Well, I've had many scenarios. I think termination of babies, when I felt very uncomfortable with taking care of that patient and thinking that this is not the right decision. Like I feel that it was the wrong decision. Or some people, now I tend to love taking care of patients who are giving their babies up for adoption. But I know some nurses felt very uncomfortable taking care of those patients. I loved it because I thought, how fabulous that they've chosen life and they've chosen to give this baby into a wonderful environment. So those are some of the situations. Thankfully, in those situations at Lankenau, where I've practiced, we do have the ability to say that you can write a letter to administration and say that you would prefer to not take care of patients in certain circumstances, and they will honor that. It does get very tricky because of the staff, because now you're standing up to the whole entire staff, because guess what? No one wants to take care of those patients. Even whether they're pro-choice or whether they're pro-life, it's still the rotten assignment that nurses don't want. And so, no one wants that assignment. And, when you're like, oh, I can't take that assignment, it is very, you're really standing up for your beliefs in a way that could come back to you in a very negative way later on, with you getting rotten assignments, that kind of thing. It's a challenge.
Thank you. There's a question that comes from the Zoom chat from Kevin Pope. Kevin asks, as Christian medical professionals, how do you address Christians who are skeptical of or reject medical interventions? For example, the efficacy and safety of vaccines.
That's a sticky wicket.
Thanks, Kevin.
So, I think that you need to consider some of the context. And in my work, as I mentioned before, I've done a lot of work with African American populations, so marginalized and also vulnerable populations. And there is a warranted mistrust of medicine and research. And so in those situations, I am very sensitive to those barriers. They are very real barriers. They are very real experiences. There's a very real history. And so when it comes to vaccinations, for example, there may also be some concerns and some uncertainty that needs to be addressed. However, I do believe that with some education and with scientists and researchers and medical providers that are providing culturally competent care, that you can overcome some of those barriers, and they can become facilitators in building a relationship between congregations, churches, and the medical community. Again, my approach has always been to sort of assess the situation and to come up with a collective way of moving forward, and being there as an advocate and being there as a person that can give some education in the science. This is what we know to be effective, and also just allowing people to come to their own decision, come to their own decision point, and being able to honor that, and being able to also, voice my own perspective, and with the intention of everyone living to their full extent of health and potential. So,
I've seen it circulated that I trust the vaccine more than I trust the virus, and I've been accompanying people who have been wrestling with whether they want to take the vaccine. They're afraid of possible consequences, and I think the most important thing is the power of their story, giving them the space to completely express what their concerns are, so that we can properly educate and meet them where they are. I think this sort of top-down often doesn't work, just telling someone it works and leave it alone. Most people have come to understand reasoning for vaccines and other medical interventions from being able to have space to give full voice to what their concerns are and what their hopes are. And for me personally, it is that being with people who have gotten the virus, being with people who have not had all the comorbidities and concerns and then still gotten very sick. And I just don't want to see that anymore. I don't want to see people be that ill, that debilitated, to have that long of a journey of recovery afterwards. And so as much as we can collaborate with scientists, with researchers, to find the best ways to prevent illnesses and to recover from them, I want us to have that space.
I'm only speaking from personal experience. The people I know who have struggled with the vaccine aren't struggling as much with the science behind the vaccine, but behind the politics and the money with big farm and all those things. So that's my own personal experience. I haven't seen many serious faith-seeking people question the science of the vaccine. That's just maybe I'm limited in my experience, but that's been my experience. So I think that this is fraught with so many things beyond science, that it's the people are afraid of their rights being taken away. People are afraid of politics, and it's just a bit beyond. And unfortunately, we know that science operates within this community, right? So like we operate within pharmaceuticals and within this is how we're working within nations, within politics, and so it's a challenge in that way.
Good morning. I think my question was somewhat answered, but I wanted to know if you face any challenges working with like people who are maybe opposed to mixing faith and science and that type of work. If you ever face any difficulties with people that you work with, or even colleagues or patients, if that's ever an issue that you come across. Thank you.
I was starting. So I think that I want to make note of the fact that there are so many individuals that I worked with that are open to integrating science into their venues, platforms, so on and so forth. And I do want to, make that acknowledgement that particularly I believe in the health sciences and medical sciences, that there is a little bit more openness to a degree versus some of the science around astronomy and creation. Sometimes I feel like there's a little bit of a conflict with that, a little bit more so. However, in those instances where I have experienced some reservation about integrating science, health sciences, and research into congregations, it's normally been a little bit of what you said. It's not for lack of trust in the findings, the scientific findings. It's more of a personal type of issue. Sometimes I think there's a little bit, in one of the conversations I had with a pastor some time ago, and as we were beginning to intervene or develop an intervention for the congregation, he was saying, one of the difficulties with having a researcher or a scientist come into the church is the problem of being uncertain and being fearful, not feeling as though they are equipped to know everything that the scientists might be bringing in, and they don't know exactly what impact it's going to have on the congregation once it comes. So I think that there's a lot of fear and uncertainty. You don't know the extent of what is getting ready to be said. And I think there's a little bit of fear about being out of control. Like, what happens if questions are asked and I don't have the answers to them? And I think that this is something that all of us struggle with, just, not just from a scientific perspective, but from a spiritual perspective, from a psychological perspective. When we don't have the answers, a lot of times we fear that, and we fear the questions and the uncertainty of that space. And so I think that that is one of the primary conflicts or, barriers that occur, is just that fear and that uncertainty and that, level of, I don't know all of the answers, and scientists don't know all of the answers. We're all in the boat together, but it's sometimes hard to actually admit that. So.
Yeah, I've, after 18 months of pandemic, I've done a lot of research on how my romantic relationship, my relationship with my husband is impacted by our feelings. And I've seen how that dynamic plays out in a bigger role. And so I see this between medical professionals and patients and families, where one takes on one level of certainty, and then the other, by nature of reacting to that certainty, goes certain in the other direction. And most people have sort of a mixture of feelings. There's more nuance to what we believe and how we've come to our decisions. But when somebody comes with such certainty, the other sort of matches that. And then there's very little room for discussion because our walls are up. And so what plays out in my relationship also plays out in the relationships of our communities. And I think as we can step more into sitting in those paradoxes and sitting in uncertainty and admitting that we don't have every answer, if we allow ourselves to sit in uncertainty, we can also embrace wonder and awe. I think when we let go of those moments of uncertainty, then we lose that. And there is so much to see that can inspire us and allow us to see God moving in beautiful ways. But when we come sort of with our dukes up and unable to hear the other side and to say, I don't really know what the next step is, but I'm hoping for this, and I'm willing to hope with you for this next step to happen. And to say, I don't fully understand what you're advising for my loved one or for myself, but I'm willing to journey with you and still hope for a miracle. That's where we see these moments of big healing, of transformation in people's lives, where we can actually transform something instead of just move them to the next step. But I think coming at it with a posture of, I am certain and I know exactly what the next step is, really prevents the other from having space to speak and share their story.
I don't have anything to say. They did such a nice job.
I think we had another question over here.
You may or may not have an answer here, but I do have a question. So, do you have a favorite example of a miraculous or an unexplainable recovery that you've seen that science can't really answer? That you're just like, wow, how beautiful is God?
I feel like there's so many. Let me see a specific one. So I think that a lot of the miracles that I've seen, most of the ones that are most impactful to me have been, personal, and also in, very close relationships that I've had with other individuals. And so I've seen numerous examples in practice, in particular, where someone was literally at the brink of death and recovered in a way that was completely unexplained, by science or medicine. I remember an instance, when I was practicing, there was an individual, and a lot of my work has been around HIV prevention and care. And I remember as a new nurse, a brand new nurse, I did have a patient that was dying from an infection because of the immune system being compromised and living with HIV. And his family and his friends really clustered around him and really gave him a prayer vigil. So they were there when I got there in the morning, they were there when I was leaving in the evening, and it just continued in that way. And somehow, some way, he recovered and was discharged, and there was such a celebration, such a joy in that, and it was completely unexplained. The physicians and the nurses, including myself, were waiting with bated breath, believing that this was going to be the last time that we saw this individual. So I strongly believe in prayer, and the research even indicates that there's a huge impact of prayer and the social support that is surrounding that, and he did indeed recover. So I think that would be one of the stories that I would share.
One thing that comes to mind is, so I'm part of the perinatal bereavement committee, and so I take an active role in labor and delivery and maternity when there's been a loss of a pregnancy and a baby. And many of our patients come back to us time and time again. Often they've had multiple losses, they've struggled with infertility, and I'm often there at the moments of grief. But I think it was 2 summers ago, I got to do blessings for 2 babies who came into this world, and they made it through. And after multiple losses, multiple rounds of infertility, unexplainably, their parents were able to get pregnant and carry to term. And I'm sure if we dug down deep, we could find some reasons, but I leave that to the miraculous. And I was so overjoyed that I was able to accompany them and support them in that moment. I will say, as part of the committee, we don't say that doesn't happen for everybody, and so we accompany each person, knowing that everybody's story is different. And just because one person had that kind of miracle doesn't mean that everyone will. And so we sit with people in their grief and not trying to move them to hope for a miracle. But in those 2 cases, I was able to celebrate that miracle with those families.
And I'm thinking as they're speaking about how I've never seen like a Lazarus story, right, where someone was dead and they came alive. Something like that was that crazy, and yet God works through this science. Like those stories are science at work that God is working through. And I think of my own story. My mother-in-law who had a small bowel obstruction. She aspirated, and she was, they called us in and said, please come and say goodbye to her because she's going to die. And, it just starts like one vital sign at a time. Yeah, maybe she's stable enough to go down to the MRI. She wasn't before, but now she is. And then, oh, the MRI says she has a small bowel. Okay, well, let's send her to surgery. It's one step at a time through science that God is working. And that's the exciting thing. Like God is working through the science. And so I haven't had, the Lazarus miracle, something that's so like, wow, like that was God, but it was God who did every step of the way. And so,
Thank you. Nicole?
Sorry, it's a little. Hi, my name is Nicole, and I am a pastor in a congregation, and I love hearing you all talk about the ways that you address concerns, addressing the fear especially. I think, especially in the last 18 months, that has been at the root, I think, of a lot of what's been happening. And I, as a pastor, when I visit folks in the hospital, a lot of what I have found to be one of the roles I can provide is to instill confidence in the medical field. So if you're afraid they don't have your best interests at heart, or if you're afraid that they're making careless decisions, or if you're afraid about all these kind of things, like, no, I know that doctor, and they may not be very nice, but they're very smart. And they're going to treat you, and they're going to save your life. Like, that's a possibility, right? And so if I was recently with a friend who just, every time somebody would make a name mistake or something like that, immediately distrustful, and part of it, I wanted to remind her, like, okay, that also means that you have they're double checking so that they don't make the mistake, and so kind of almost translating in some way of what's going on. How would you recommend, for pastors and for just congregations, how do you help instill that confidence? Once you've addressed the concerns, once you've addressed the fears and, the distrust, how do you help instill that confidence?
From two parallel ways. One is instilling the confidence from a scientific perspective. We run our randomized controlled trials, and we have our scientific findings and research findings, and the confidence in that, medicine is a practice, and we have come a long way. But another key element, I think, for instilling confidence is the spiritual, the faith. And it is a blessing in many ways to have both of those, and to have both of them coinciding with one another. So you can, say our research findings, our scientific findings have indicated that this is the best course of action. This is the best treatment for you. This is the best way of tackling whatever disease or illness that you are suffering from. But we also know that we have God, and that we can depend on and trust in God and have faith and confidence, not just in the medical providers and the healthcare system, but in God, who created science, who created medicine, who was the originator and founder of all of the knowledge that we have to this day. I think that if you can pull those two things together, then you are indeed a blessed and fortunate person, because you don't just have the net of science, but you have the net of God and faith. So I think that that's how I would approach instilling confidence in those situations.
I would say that acknowledging that the person who is in that place is going through trauma. I think sometimes we think of trauma just as the car accident, the act of violence, the big hurricane. But coming into the hospital itself is traumatic. Getting a diagnosis, waiting for that phone call after you've gone in for a test, those are traumatic. And these are traumas that build. So generally, it's not just one thing. They came in and then they sat in that waiting room waiting for a result for 45 minutes. And that trauma and that anxiety built. We have heard stories of others who have had difficult diagnosis and gone through different problems, and that builds on that trauma. We're in a constant news cycle where we're seeing things on our Facebook and social media, and our trauma is building. And so to try to accompany someone without acknowledging that they are in a moment of wrestling with this trauma, I think we have to acknowledge that first, and then give space for people to to release that so that they are in a headspace that they can receive what's next. We only have so much capacity to take all of this in. So acknowledging the trauma that they are experiencing, and then having a diverse interdisciplinary team. Advocate to have multiple layers of support, to have family members. The number of times that I have, sat with my own family members who have been ill, and I have felt like a fog, where whatever the doctor was saying to me, I have no idea what they said. Charlie Brown parent voice, and I am so grateful for when a loved one is with that patient who's hearing from a different angle, when there's a social worker involved, when there's a chaplain involved, when there are people who look like me and sound like me, who might be closer to my age, who have gone through similar things, who can help accompany me. So having that diversity in your team helps also to receive the information and make a plan in a way that best fits my life, because it is not one size fits all. And so acknowledging all of those things and building a support network so that you don't go through this alone, I think is essential.
They both said it so eloquent. I feel like, I don't want to say pass, but, what else is there more to say? Because I really agree. There's the science part and there's the emotional part, and without hitting that emotional part, the science is just Charlie Brown voice, as you said. Yes, yeah. Mm-hmm.
Hi, my name is Angelo Soto, and I'm an Eastern student here. I'm a senior, and I just want to thank you very much for coming and taking time out of your day to come speak with us with issues that are very prevalent right now, especially with COVID and this pandemic, and especially in the medical field, I think, right? And I think I just want to make a comment that in the medical field, it is hard. It's difficult. Like, I'm a political science major, but I have friends who are nurses and stuff and all that, right? And I guess my question is, like, for me, because I am very, concerned about, certain, healthcare things and stuff and all that, right? Especially pertaining to the vaccine and stuff and all that, I think. And that, especially for me as an African American person and all that, that I have people telling me, "Oh my gosh, you don't know what you're talking about" and stuff and all that. And it's very disturbing to me that we have people in this society who are medical professionals, stuff and all that, and that you have to do this, you have to do that. And I guess, how do I, as a person who wants to go into law school and stuff and all that, right, and fight for people who are disenfranchised, who are worried about taking a vaccine, who are worried about medical things and stuff and all that. And I guess, how do we navigate through a pandemic, I guess, rather? Because this has been a very hard 18 months for all of us, I think, not just me, but for this whole world, I think. But yeah.
She's saying I'm supposed to start. Why, thank you. It's really hard. The message I got more than anything from that is that it's really hard. And there are people who have different opinions. I do recommend that people look at the sciences, and it's hard for people who aren't scientists sometimes to understand. And I said before, there's a basic mistrust. Also that, I know with the vaccine and the anti-vaxxers, you can't find, I tried to find support for people not getting the vaccine, and you really can't find it. And why is that? That's a distrust, because you have to go to practically the dark web
in order to find that information. And so that again leads to distrust, because why is that information up there? So I don't really have an answer, but I will say that your question, I think, was how do we navigate this? And you want to be an advocate for people. And I think, again, do look at the literature that you do see and evaluate to how much is the issue pertaining to science or to politics or to, the rights that people have. Like autonomy is a big issue. A lot of people, anyone I know who does not want the vaccine, it has to do with their autonomy. Like they don't want to be told what they need to do. And so, I think just encouraging people to look at the facts. And that's the science part of this, right? Look at the facts.
I think this is like my growing edge, is to not live in silos, to listen to many different things, have a diverse group of friends from a lot of different careers and walks of life, so that you hear how they've wrestled with things, because some things they're probably right alongside you, and then some things they might help to expand or give you more wisdom into making your decision. But I think, I love the many things that I can do with the internet, but it also allows me to only listen to people who say the same thing as me. And I don't read as thoroughly when it's just like, yes, I totally agree. But when it's something that challenges me, I'm going to read a little more thoroughly. And I think we need to open ourselves up to really be with people who are a little different than us and help us understand the fullness of every decision we make. I have really benefited from having people from different faith groups, different places. I just enjoy having that history so that I understand how they got to where they are, and I can better make my decisions that way.
So I think that there needs to be some critical restorative and healing work that needs to be done in the medical sciences, because I heard your question in sort of echoing some of what I said earlier about the mistrust that's, just inherent amongst individuals of color and other individuals that have been afflicted in some way or wounded in some way. So I do believe that there needs to be some work that is done on behalf of medical professionals as well as researchers to be a better advocate for people that are living at the margins. So I do want to acknowledge that. And I also believe that there is a lot of promise in what you said, that you also want to be an advocate in your domain, in your discipline. And I think that is so important and so critical that, as an African-American woman, I'm always cognizant of the fact that, in my work with other African-American populations that, sometimes I'm putting on the scientist hat and it automatically, they're like, oh, we thought we liked you when you first walked in the door, but now we're not so sure. So I'm still cognizant of the fact that there is that healing work that needs to take place, and that it's so much more critical that I am responsible in what I'm saying to individuals about the science. They might not necessarily be able to interpret it and to, have the same type of, training and background that I have. But that means that I have a responsibility to make it plain, to, make sure that they understand what the research is saying, what the science is saying, and, put it in a way that not only gives them the facts, but also addresses their concerns, addresses their perspectives, and partners with them rather than being over them and dictating what they should and should not do.
So there has been incredible advances in medical science, obviously, and especially with unlocking the genome, and we're moving closer towards individualized medicine and these incredible robotic surgeries and implants, and people are living longer and healthier lives than ever. The life expectancy keeps getting higher and higher and higher, which potentially presents some moral quandaries as to at what point are we healing and at what point are we playing God? Do we then have a moral responsibility as a society to care for a population that is not dying at the normal rate? Can we handle overpopulation? Do we need to have these sorts of considerations while we're advancing science? Do we then are we asking, is this the right thing to do? Do you have any thoughts about our ethical and moral obligations towards people as we extend their lifetimes?
That's a great question. So you should go first.
I think that we have to first make sure that we are educating the population about what direction we're going, because I think most don't fully understand what the implications are of these advancements. And so starting with more information for those who may receive these advancements would allow them to be a part of that dialogue. I think also, being someone who's part of goals of care conversations and ethics consults, people need to have more understanding of their autonomy. Is this what you want? Does prolonging my life without my quality of life valuable to me? And people have different opinions, but we bring these questions to people when they no longer can give the answer. And so having these conversations earlier on, allowing people to understand what are my options and what would I want in that scenario. I've had this conversation with my own parents time and time again about, having living wills, and they get a little nervous and then they say, well, I just pull the plug if I'm not going to come back. And I said, this is so much more complicated than that. And there is no plug. So we need to allow people to understand there are so many different interventions that we have, and these are the effects of those interventions. We can do this right now. And if we start practicing with the advancements that we have right now with ventilators and heart-lung machines and different immunotherapies and all of these different surgeries, if we start by explaining and helping people understand what they are doing to their bodies and what it will do for them in the long term, then I think we can branch that out into the bigger global discussions about what will this do for our population? But we're doing a disservice to people by not having this conversation right now with what we have. And I know it's scary to talk about death and end of life and illness. I'm tired of being the angel of death among those I talk to and having those conversations. But if we normalize end of life as part of the life cycle and give people true voice about what they would want in those scenarios, then we allow them to be an advocate for themselves and then for the world as we make more advancements.
So I saw in that question two different elements that I will attempt to address. The first is, do we have a moral obligation in the work that we do? And I would give a resounding yes, and that's about all I can say about it. But no, really, I believe that is part of the piece of those individuals that are sort of on the forefront of integrating science and faith. Because the moral responsibility and the moral obligation and the moral directioning, if you will, has to be rooted in a moral God. And to have the ability to come from that perspective, I think is key in being able to responsibly practice medicine and responsibly be a scientist. That's not to say that, those individuals that do not have a connection with God are, that their research is, unmerited or, not contributing to our understanding. But I do believe that it is God that anchors us in that morality as we are engaging the sciences. And the second question that I heard is, through our advances in this field, are we playing God? And my perspective is that God is sovereign over science and over medicine, and that it is only because of his delight in giving us insight and giving us knowledge and in giving us, advancements in these areas that we are able to even capture them in our minds. And that there's always going to be an element that we just don't know. And I feel that that is also God's delight, to hold back and not unveil everything at once. So I do believe that we are not playing God in the advancements that we have made as a field in medicine, but we are being good servants to the knowledge and the insight that is divinely given to us in this field as scientists and researchers and practitioners.
I heartily agree with that too. And I think about even if you looked at like the 1940s or the 1920s, they would have thought the advancements we have even to the point where we are now in 2021, they would think that that was way beyond, and I have to, my husband and I disagree on some things, and he, about pulling the plug, we definitely disagree about that, because I'm like, pull the plug, I don't mind, I want to go to my heaven, I want to go to my maker, and he's like, no, so, but, I will say, like, when we're talking about this, we're talking about the only thing that these people have at end of life. Like when we're talking about pulling the plug, is they're being sustained only because of these scientific things that are happening for them. Like 20 years or 40 years, they wouldn't even be alive. They would not be alive at all. So it's because we've done these interventions with them that has sustained their life. So I do think about the new advances that are coming, and I think we have a moral obligation, but I think those are wonderful things to explore. If we can solve a genome or a problem in the chromosomic level before it becomes expressed, how fabulous is that? And I think that's not playing God. I think it's God using science to advance what we are capable.
We have time for one more question. Did you have a? Oh yeah.
Thank you all so much for your really heartfelt, insightful comments. I just wanted to circle all the way back. In the beginning of your comments, you talked about how it's becoming more recognized in the medical field that faith plays an important part in people's lives and their whole well-being and health. And I was wondering if that's really taking root in medical schools, in the leadership, in the training of medical professionals. Is it being taken more seriously at the top levels that the faith component of people's lives is important, it's real, and needs to be honored, respected, and included in the holistic healing and treatment of people? Or is that something that still needs some more work at the top levels of medical training and medical authorities?
Well, I can't speak for medicine. I can speak for nursing. And I can certainly say that it has become much more an emphasis. The holistic, nursing has always looked at the person as a whole person. All this, their spirituality, what's happening with them mentally, what's happening with them physically, as a whole person. But it has become much more an emphasis within the nursing. And I would say that even I think about, like, I've been at Lankenau Hospital since 1986. We didn't have a pastor. We didn't have a chaplain coming and helping us back in 1990. Like, it's becoming a value within medicine to have a chaplain, which is wonderful. Like, so I do see that trend happening within medical care. I don't know about the top leaders of medical schools.
Yeah, I don't have the statistics, but I have a lot of anecdotal experiences with leaders in my own hospital and hospital system. I wrote a grant to the George Washington Institute of Spirituality and Health and was able to implement reflective rounds for our medical students when I was at Jefferson. And that was a study that was done across the country and a couple in Canada. And from what I've heard from other friends who are in medical school or working in medical schools is that these reflective rounds are growing and continuing to be implemented. And it gives students an opportunity to engage in their spirituality, to engage in their emotional health. In that third year of medical school, when so many feel sort of shell-shocked from book learning to patient care. And so I can see that intervention is growing. And there are so many other grants that are open through Templeton and Luce and many other philanthropic organizations. So it's not fully embedded in the curriculum, but I'm seeing that more and more are adapting these grants and these studies so that it becomes implemented moving forward. And I'm seeing medical students pull me aside more and more. So they know that there's a chaplain. They know that there's somebody here who can support them. They're not always super ready to do that in front of everybody else. I've been pulled into many a supply closet to pray for somebody. But it's certainly growing from when I first started till now.
I would concur with the things that were said, particularly from the standpoint of nursing education. It has always been a very holistic approach, incorporating not only physical health, but spiritual health and mental health and so on and so forth. I think that there has been a greater push over the years to incorporate faith into the disciplines, the medical fields and domains. And I think that there is still a little bit of hesitancy in the scientific academia types of milieus, if you will. There, as I indicated before, or at the top of the hour, I have had some challenges, a lot of challenges in being able to convince people, so to speak, that, faith does matter and that is something that we should consider. And, I think about, some of the grants that I've written and the feedback that I've received. A lot of times there's still individuals that are like, I don't see why this matters. I don't see what kind of impact this is going to have. And you have to really provide a very strong argument as to why faith needs to be incorporated in, research and scientific experiments. However, I do believe that we're getting better. I would say that there has been work that has been undertaken and that there's still growth to occur. And I feel that, there should be individuals that are are pioneering this and sort of paving that road, because somebody has to go out ahead and make the integration of science and faith real and for the sciences.
Thank you. I want to lift up a quote that was left in the chat on Zoom from the Reverend Mr. Rogers, who we call St. Rogers in our house. To die is to be human. All that is human is mentionable. Everything mentionable is manageable. Thank you so much for mentioning, for speaking, for giving words and names and concepts to the sorts of traumas that we all feel and the sorts of fears that we have. I think I can speak for everyone here that we have all grown and learned, and I know I will be implementing some of this wisdom in my everyday life, probably even today. So thank you so much for your participation.